Prolotherapy can be used to treat any of the joints in your body, from your neck all the way down to your toes. It's astounding to me that we don't use it as much as we can, because it is a treatment for these things. It's not a band-aid like steroids will have, and it doesn't have the same side effects as steroids. So what is prolotherapy? Prolotherapy comes from the word proliferate, and the idea is that we're proliferating, or we're regrowing normal tissue. The way that it works is through creating a small injury, causing a little bit or a controlled amount of inflammation, and from that your body starts a healing cascade, we call it, and is able to heal the injured tissue just in the same way that it would heal a cut or a broken bone or other injuries that happen to you. I tell people we treat 3 to 6 times with prolotherapy. Typically what we do with prolotherapy is we treat at day 0, and then we treat 4 weeks later, and then we treat 4 weeks after that. Usually after the second time, between the second and third treatment, is when I start to notice differences. It's a wonderful adjunct to treating chronic pain, ligament hypermobility, specific joints that have a larger range of motion than other joints, arthritis, whiplash, and other types of injuries. After treatment, there's 3 phases of inflammation. What I tell people is that the first night may be uncomfortable. After that, there may be a flare at about 2 weeks. It can be 10 days or it can be 20 days, where you can experience increased amount of pain for no reason at all. And I tell people just to put it on their calendar, expect that it happens, and if it happens, then you know why. It's just a sign of your body healing. Prolotherapy is not covered by insurances, and the price can vary. My prices vary according to the size of the joints. So smaller joints are less expensive. Large, medium-sized joints like the elbows are and the ankles are a different tier, so they're a little bit more expensive than, like, for example, fingers and toes. Larger joints, for example, knees and shoulders and hips, I put those in the same price range. And then for backs and necks, the back is probably the most, requires the most number of injections and is the biggest area. Different doctors charge different amounts, and I would say for the large joints, or for the back, for example, it can be anywhere from $350 to $500, maybe even more. I don't want this to be totally prohibitory to getting it done. My price range probably is in the middle of the road.